Describes the need for and motivation behind the development of standardized terminologies for nursing.
A nursing terminology is a body of terms used for nursing. A term at its simplest level is a word or phrase used to describe something concrete or abstract.
There are many nursing terminologies, formal and informal. Nursing terminologies allows one constantly to capture, represent, access, and communicate nursing data, information, and knowledge. A standardized nursing terminology is a nursing terminology that is in some way approved by an appropriate authority.
10, CNP2 recognized the following 7 active nursing terminologies, also known as interface terminology, clinical care classification, internation classification of nursing practice, North American Nursing, Diagnosis Association International, Nursing Intervention Classification, Nursing Outcome Classification, Omaha Home Healthcare System, and Preoperative Nursing Dataset.
Each nursing diagnosis may have a set of defining characteristics and related or risk factors.
Which words or phrases are represented on a list in a simple hierarchy. The ontological approach is compositional in nature and a partial representation of the entities within the domain and the relationship that holds between them. It provides a resource used to develop local terminologies and to use cross-mapping between terminologies to compare and combine data from different sources. There are many differences between the nursing terminologies in terms of scale, scope, structure, and intended use.
For a statement to be considered a valid nursing diagnosis, it must, at minimum, comprise both a focus and a judgment. For example, impaired physical mobility is considered a valid nursing diagnosis because it compromises the focus, physical mobility, and the judgment impairment.
Terminologies help to convey the understanding of the world. For example, a restaurant menu lists all of the dishes one may wish to order. This represents the terminology. The menu organizes the dishes in a way that encourages one to select dishes and allows one to select dishes according to shared view of the world. This represents the model of terminology use. The menu encourages one to make use of terminology while delivering it in a way that fits the task.
Examples of assurable models of terminologies used include archetype, care information models, clinical statements, templates, clinical elements, and detailed clinical models. An archetype is a computable expression of a domain context model in the form of structure statements based on the reference model. Archetypes provide a mean of defining clinical and pragmatic knowledge apart from the application that may use it.
Archetypes are used as an example to illustrate the common principles that underpin many of these initiatives.
Without constant terminology, nursing runs the risk of becoming invisible. It will remain difficult to quantify nursing, the unique contribution and impact of nursing will go unrecognized, and the nursing components of electronic health record systems will remain at best rudimentary.
Presents nursing outcomes classification. Hi, my name is Dr. Vanessa. Your results came in, and unfortunately, you've been diagnosed with leukemia.
Clinical care classification is one of the nursing terminologies that have to do with nursing outcomes, interventions, and nursing diagnosis. You take Advil when you have a stomach ache, headache, or you're hungover from a good night at the bar. While taking Clarivis, you cannot drink for 6 months, and you cannot conceive a child because of possible birth defects.
And here we have low estrogen, which is birth control that women use to prevent pregnancy. Also, Centrum, which is vitamins that people use to get strong.